presence of our Honorable Lourdes Leon Guerrero, Magahagan Guahan, Governor of Guam. To her left, we have former Lieutenant Governor and State Surgeon, Dr. Michael Cruz. We also have in our Zoom room present with us today, Director of the Department of Public Health and Social Services, Art San Augustine, as well as Public Health Chief Medical Officer, Dr. Felix Cabrera. At this time, I'd like to give the floor to Governor Lou Leon Guerrero for her remarks. Governor.
Thank you, Crystal. Thank you for those joining us in this press conference today on March 22nd. And I wanted to hold this press conference because, as you know, we have sent off specimens to CDC since January. And we have gotten back last week some of the findings that the U.S. Centers for Disease Control and Prevention have sent to us. And over the weekend, Public Health thoroughly reviewed these findings, and we are here today to share what we've learned. In total, Guam Public Health provided CDC with 49 samples collected from COVID positive cases, as I had mentioned earlier. Last one was in January. We received the results from 26 of the 49 samples. And here's what we know. 7 of these samples had the California variant, a variant that is known to be 20% more transmissible. Of these 7, 4 came from samples within the community. These 4 individuals had no known travel history. The remaining 3 samples came from persons who tested at our quarantine facility. It is important to note that these samples were from positive cases, like I said earlier, in January, which means even with the California variant in our community, our COVID-19 response has remained robust. None of these samples had the UK, the South African, or the Brazil variants. As a result, we will continue to stay the course. Today marks day 29 in PCOR 3, and most all businesses have been operational with moderate restrictions. Today, we have only 1 COVID-19 in our hospital. And today, our COVID area risk score remains at a low 0.1. We have to continue what we know works for us, and that is wearing a mask, washing our hands, and watching our distance. Paired with regular community testing and our aggressive vaccination efforts, we are well on our way towards achieving herd immunity through Operation Liberate Guam, or 80% of our population fully vaccinated. We also remain committed to our Path to Half initiative. That means if we fully vaccinate 50% of our adult population, that's about 62,500 people, by May 1, 2021, we will reopen to our travelers again. This means we will be open for tourism because passengers with the negative PCR COVID-19 test 72 hours prior to arrival will be exempt from quarantine. Again, the change in quarantine protocol will only happen if we achieve the Path to Half. To date, we have 30,735 people who have been fully vaccinated. As we continue to lower the vaccination eligibility, we expect more people to get shots in their arms. Effective last Thursday, individuals 40 years and older became eligible for the COVID-19 vaccine. To ensure more people get vaccinated, I will be allowing administrative leave for GovGuam employees to get their vaccine, and I encourage the private sector to follow suit to give their employees ample time to get their vaccine. For further details regarding the variant and what this means for our island, I now hand it over to Dr. Felix Cabrera, who's the Chief Medical Officer for Public Health. Dr. Cabrera?
Thank you so much, Governor. Hafre Guam. So I know that this has been news that we've been anticipating for quite a while, and as the governor had explained that one of our fears, of course, was that the UK or the Brazil or the South African strains may be here on Guam, but what I wanted to do is give a little bit more context to these samples here. So they range from January 13 to January 28 is when, in terms of the results that came back. And so that's already multiple incubation periods that have occurred. And the fact that our CAR score, again, is still 0.1 and we only have one person admitted in the hospital with COVID, those are all very positive signs overall. The CDC has categorized these variants into three main categories. The first one is a variant of interest. And so, for example, that's the one that is identified in New York. And then there's a variant of concern, which here is where the main variants that we're familiar with from the media lie. And then the last category is a variant of high consequence. And thankfully, there is no variant that fits that category as of now. But the CDC has their thresholds for certain transmissibility and severeness of illness. So the B117, or the one that was first located in the United Kingdom, it has a transmissibility of approximately 50% increase from the wild type, or what we know as the typical coronavirus we've been dealing with throughout this pandemic. And the increase in severity or illness is very likely in that virus. The P1 is the Brazil/Japan variant, and then there's also the B1351, which is the South African. Those are similar in a sense, but then the data does show that the South African is 50% more transmissible overall, but not enough data is fully there, but it's well believed that there is some increased severity and illness and some concern about the vaccine overall. Now, for the California, there are two different ones. There's the B1427 and the B1429. The B1429 is what we've identified here. All 7 of them were of that variant. But combined, it's important for us to note that that's actually the predominant variant in California today. More than 50% of the cases in California are one of these two variants, and they've been present since fall. And that's likely what led to California's significant spike in the fall and early winter. Those are 20% increased transmissibility overall. And there is early data that shows that the severity is likely also that is increased. But so far, the good news is that there is some concern that maybe the antibody therapies like plasma or some of these monoclonal antibodies may not be as effective. But everything we understand right now about the vaccines is that they're still effective. They're effective enough. And so that's why it's very, very important that we still continue this race to vaccinate. And I encourage everybody to please go out, and especially as the eligibility criteria changes and you become eligible, please make your way to the vaccine pods and get yourself vaccinated. Thank you.
Just add, though, I think that the combination or cocktails on the antibody therapy, though, has been effective, right? As far as some of the research they've seen in California, is both with the bamlanivimab and the additional other cocktail as well.
Yes, yeah, as minimal. There is minimal concern that those aren't necessarily effective. So that's good news also. Unlike the other variants that are not present here, at least that we don't have evidence of its presence here on Guam.
I'd now like to open the floor for questions from members of our media. I want to remind you that in addition to Governor Leon Guerrero, Dr. Cruz, and Dr. Cabrera, we also have Director Art San Agustin on the Zoom call as well. The first reporter for questions, Jarek Sablon, Pacific Daily News. Do you have any questions?
Yes, hi, Governor. I wanted to ask you, the last few days, we haven't had any cases of COVID-19. and that's a good sign. Are you planning on lifting any further restrictions anytime soon? If it continues this way, what are your plans?
Yes, we're looking at that, and probably in the coming week or the following week, we will be lifting restrictions. Most of what we would be lifting would probably be increasing more of the opening occupancies for other kinds of, for the retail, your hair salons, those kinds that are now that are now 50% will probably be, I think, 75%. So those are the businesses that we're looking at, and will probably increase social gathering numbers.
And then the other question I had, I guess, for Arts and Augustine, now that you guys confirmed there are these strains on Guam, are there any changes to the quarantine or isolation protocols now that you've confirmed that there are strains, or is it going to remain the same?
Actually, to your question, Jarek, it'll remain the same. We have no indication at this point to make any changes in terms of our quarantine protocol or travel protocol. Thank you.
Thank you, Jarek. We'll come back around for a second round of questions. Next, we have Jerry Partito, Pacific News Center. Do you have any questions?
Yes. Is there a way that we can develop our own testing facilities here to test for the COVID variant? Because it takes so long for them to get back to us. I think it took about 2 months, right? So is there anything we can do or to hasten the results getting to us?
Probably Dr. Cabrera or Art can answer that, because I think it has to do with the equipment, the expertise, and the processes. So I would venture to say we probably won't be able to be doing it, but we will be able to continue sending it to CDC for sequencing.
Yes, thank you, Governor. That is correct. And so these tests are extremely sophisticated, and we're sequencing these viruses' genome for each sample here. And so right now, the most efficient way is the whole effort that has been undertaken throughout the country, where we have a lot of the both private and partner and private and public labs working together in terms of all these sequencing efforts. And the CDC has been, of course, leading this with HHS. And so it is the most efficient and cost-effective way to continue to just send our samples there rather than trying to build a whole genomic lab here on Guam.
Yes, and for my second question, this new variants, how strong are they? Are they deadlier than the original one, or do they just spread faster? Or I mean, what if we get one of them here? What does that do to us? Do our vaccines work against them?
So I can try and answer that question as well. So Gary, the two parts here is that being more transmissible ultimately can become more deadly, because the more it spreads out, the more likely it gets to the vulnerable persons. But in and of itself, this California variant, early data does show that it's likely to increase hospitalizations and potentially even death. And so that's what we do understand. However, that's from data back in before the vaccines were even out in California. So early studies are showing that, and that it is hopeful, and it does appear to be promising that the vaccines we're currently using are going to be effective and have been effective. And so in the end, ultimately, if it may increase the severity of illness, the vaccine will actually help prevent that severity of illness. So that's what we really care about the most. And so as evidence is that it's been here for almost 2 months now, at least that we have evidence of, and look at where we are today. So we're doing the right things, and as long as we continue to do the right things, and everyone continues to get vaccinated, we should be, everything is pointing that we should be okay. But again, it is a race, and that we have to do this as quickly as possible.
And then to add to that, Jerry, is the fact that the immune system is quite complex. And beyond antibodies, there are other immune cells that are involved in the whole immune process. And so those are things that we still don't really have a good answer to. But again, suffice it to say that this was a snapshot of cultures taken or specimens taken back in January, and the fact that we've seen a significant decrease in the number of cases and that we are where we are today is again good news.
Okay, I'll come back for a second round. Thank you.
Thank you, Jerry. John O'Connor, the Guam Daily Post.
All right, thank you, Governor. So I did have a question about the vaccines. According to the CDC, we're still learning how long the COVID-19 vaccines protect people. So I was wondering if you can talk about how effective are the vaccines against all of the variants we know so far, not just the California variant, but also if you can give a bit more information on how long we expect to get protected against these variants, either in terms of protecting against the severity of disease or the transmissibility of the virus.
Have Dr. Cabrera answer that.
Okay, and so as Dr. Mike Cruz had just alluded to, that the immune response is very complicated, and thankfully so actually. And so there are these two cells called T cells and B cell memory cells. And so that's the part that we don't know, because we don't have a good way of testing those cells overall. But we think we have a lot of good suspicion that they are very effective overall in terms of producing the antibodies that we need to control these. But long story short is that the one that we're a little bit concerned about in terms of the vaccine effectiveness is the South African/Brazil variant overall, and that's specifically for like the AstraZeneca, which we don't have an EUA on, but then there is a little bit decreased efficacy with the Johnson and Johnson for those. Again, there's no evidence that they're here on Guam, which makes quarantine even more important at this time until we get more people vaccinated overall. But one thing is clear about all three vaccines that we use here, the Moderna, the Pfizer, and the Johnson & Johnson, is that they have nearly 100% effectiveness in preventing serious disease, talking about hospitalizations and death. So that's the key part that we have to really understand and make sure that everybody understands that main part in terms of effectiveness, because obviously that's what we care about the most. Thank you.
And as long we don't know exactly how long the protection is going to last, and so there is discussion amongst the experts that there's a possibility of a booster maybe in the future. Again, depending on how what we learn about these vaccines over the next several months to a year.
Could I just add also that I know that Dr. Fauci has also been sending out messages that to decrease the opportunities for these virus to create more variants, we have to be vaccinated, and we have to really stay within that period. So if you are Moderna, you need to have your second dose within 28 days. If you are Pfizer, then it's within 21 days. And if you are Johnson & Johnson, it is just the one dose. So it's very important for us as a community to make sure that we get vaccinated and that we also get our second dose, because the more we're vaccinated, the less of a risk that variants will be created.
Okay. Right. Thank you for that, Governor. So my second question is, now that we have the information that the California variant is here, what does that do for our plans for opening Guam back up to tourism in May? Does that mean we're going to be a bit more cautious about reducing some of the quarantine restrictions that you talked about in the last press conference?
We are going to stay the course, and we are going to continue with our direction of May 1st to have 50% of our people vaccinated, and then hopefully by July 21st to have 80%. So we are going to remain the course. And once we start seeing more vaccinations, we are still going to continue with the plan on our quarantine protocols.
Thank you, John. Moving on, Mariana's Business Journal, Morgan.
Hello and good afternoon. I just have one question, and it concerns the vaccine and the age groups. Is there a specific age group that you guys have seen more of an uptake than the others? In other words, have more people in a specific age group gotten vaccinated versus some of the others?
I think Dr. Cabrera will probably have more of an accurate information about that, but that's a really good question.
Yes, so the age group that has performed in terms of what we say vaccine penetration, in terms of how much of that age group has gotten vaccinated right now, what we're seeing it's the 60 years and above overall, and that you're seeing well over 60% of them having gotten at least their first vaccination, and then you're actually looking at more like 65% have gotten their first vaccine, and over 60% being fully vaccinated. So that group by themselves, they're on their way to getting to 80%. And so we just still need more of them to come out for sure, because as we know that they are the more vulnerable overall. But other than that, when we break it down, the age group, of course, as you get younger, there's less that are overall vaccinated. But we were actually surprised to learn that already 40 to 49, that age group, there's already 41.1% of them having had their first dose, and 27.1% of them already being fully vaccinated. And that's days since they've been eligible, but of course that's likely because of the crossover with the other industries that became eligible early, like for example healthcare, and then also teachers and school-based staff. And so likely that's what's had that number, giving us that head start. So we're very happy with this turnout thus far. We just really need to keep the momentum going.
Okay, perfect. Thank you very much, Dr. Cabrera.
Morgan, did you have a second question?
That is it for me for right now. Thank you.
Thank you. Before we proceed, I also want to acknowledge the presence of Lieutenant Governor Joshua Tenora, who's also on our panel in person here at the large conference room. Moving on, I want to acknowledge Nestor Lecanto, KUAM.
Thanks, Chris. Happy day, everyone. Governor, I was wondering if you could just elaborate on your what you had said earlier about providing some time and opportunity for government of Guam employees to get vaccinated. How is that going to happen? And also, part two of that question is for the private sector. How are you encouraging businesses to do likewise with their employees?
Sure. So it's sort of like the same kind of practice that we did for voting. And so we are allowing our government employees to take administrative leave to go and be vaccinated. And as a result of that, we are hoping, Nestor, that we'll also quickly increase our numbers so that we can reach the 50% and the 80% before scheduled deadline. And so I am also asking the private sector to allow their employees that opportunity to leave their work to be vaccinated.
All right, and is there any way to incentivize private sector to do that?
Sure, keep our people safe and protect yourself. I think that's a great incentive. And open the economy. And open the economy. Exactly.
And for government employees, that's not compulsory, right? That's strictly voluntary.
Yes.
All right. Thank you, Governor.
Thank you, Ness. We'll come around for another round of questions. Ethan Perez, Pacific Island Times.
Hi, good afternoon. I want to direct your attention to the alarming spike in COVID positive cases that we've seen in the Philippines in the past couple of days. I just wanted to ask if you would continue to keep a strict quarantine for travelers incoming from the Philippines, and advise postpone travel for people on island going to the Philippines?
Yes, so we are going to continue our quarantine protocol till we get to the 50% halfway mark on May 1st. And then on July 21st, we will then also further lift restrictions to the point where we can say that we have opened our island. We will continue, Ethan, the monitoring. We will continue requiring them to have a negative PCR before they come in. Right now, we will continue quarantining them as we have. We haven't yet changed our protocols. But yes, we are going to watch this very closely and make sure that we continue to protect our community as best we can.
Thank you. One more question. What is the next age group after 49 and under that will be eligible for receiving their vaccine?
So right now it's 40 and above.
Oh, 40 and above, sorry.
Yeah, 40 and above. And so our next eligible age that we will be inviting is 16 and above. And so that's basically testing everybody that are eligible for that. So the committee, the priority committee will be meeting and they will be discussing that.
Okay, thank you.
Art, I feel like you want to elaborate on that question.
Oh, actually, the governor is on track with that. We are having our meeting this at late afternoon, about 4, and we will be presenting in support of what the governor's direction is, which we see is in the right direction in the sense that based on the numbers that we've seen at the University of Guam, we are able to go down to 16 and over. It'll be through the Eventbrite, and that'll be our primary pod at the university. So we're excited the committee will support this and that we will have it effective as soon as we're able to announce it. So thank you very much, Crystal. Thank you, Governor.
Thank you, Art. Let's go back up to Jarek Sablon, PDN. Any follow-up questions?
Yeah, the bringing down the age, it just, I wanted to go back to vaccine supply. Are we gonna have enough to meet those age groups? I mean, that's basically everyone. Where are we at with vaccine supplies? Are we getting any more? And do you think that we can get to the 50% by May 1st?
The answer to your question is yes to everything. So first, the supplies we have, we are keeping close tabs on our inventory, and our supply is within what we feel will be sufficient enough to provide the vaccination. We are going to be ordering again, and I think public health is tracking another 30,000+ Pfizer, Moderna, and I think Johnson & Johnson. We are also getting separate supply for our community health centers, which doesn't impact our general allocated monthly supply. So both from the national level, they have made a commitment that they will make sure that states and territories and tribal governments will get the necessary supply of vaccines for their vaccination goals. And so, yes, we are going to have the supply. The Surgeon Cell and the National Guard have said that they can increase their resources to provide more times for vaccination. And we just have to all work very well together with the clinics, the hospitals, our sites, and also with public health, with the homebound and the community, so we can really get our people vaccinated as soon as we can. That's our goal.
In addition, there's additional supply that comes in beyond public health and the community health centers. The pharmacies that are registered are also getting supplies on their own. And the Department of Defense, which includes the Guam National Guard, also gets a separate allocation as well.
Jarek, any follow-up questions?
No, that's it. Thank you so much.
Thank you, Jarek. Jerry Partito, PNC, any follow-up questions?
Yes. Uh, these new variants, they can be caught through regular testing, right? We just don't know that they're variants, that they're new strains, but we can catch them, right, at the airport and through regular testing.
We catch them just in the sense of they are positive for COVID, but it's not necessarily positive for COVID California variant or positive for COVID UK or South African or Brazil. And so that is a great point, I think, Jerry, because catching them and continuing with our mitigation efforts, which has been working, and that is again wearing your mask, social distancing, avoid public crowds, washing your hands. All of these are meant to protect our individuals and our people in our community. So, as we continue to use and practice these mitigation efforts, we will be, I think, we will be safe for any kind of severity of the COVID viruses.
Thank you, Governor. And one last question, probably for the doctors. Uh, so far, the focus here and in the States has been on the vaccinations, right? How about the treatment side? Has there been any new developments or breakthroughs on the treatment side? And do we have those treatments here in our hospitals here?
I'll go ahead and take a stab at that question. So overall, there has not been any further breakthroughs overall in terms of new treatments for COVID. What we have found is a very effective means to use even just medications that we know very well, like dexamethasone, for example, for those who are very sick and in the hospital. So that's a type of steroid for that's been around for ages. And so that's what. But in other words, in any other new medications or antivirals, monoclonal antibodies, there haven't been necessarily anything in terms of major that is changing the clinical course for a lot of these patients. But what we do have, I mean, what is available, we do have here on Guam. I just want to be very clear about that, and that the federal government has made them available for us, and so we have been utilizing them as they are clinically indicated for our patients.
Maybe Dr. Guerrero can comment with maybe some of the therapeutics that was recommended in the past may have proven not to be as effective, such as the convalescent therapy and stuff like that. And so those have no longer are in vogue or no longer being recommended.
Yeah, and that's correct. A lot of more the data that comes out, it doesn't support some of the what we thought were promising earlier, like hydroxychloroquine. That hasn't panned out. Just so we're clear, Clorox has not panned out, and so bleach, and so there are things that we're getting obviously more data on for the antivirals themselves, and like remdesivir, for example, that still has a role for hospitalized patients. But then what we are worried about, but what we do know, again, as Dr. Cruz has said, is that convalescent plasma is not showing to be effective, not just because of the variant, just because with COVID overall, which is why we know that these other cells called memory T cells and B cells are so important, because you don't get that with the convalescent plasma. You build that, you make that on your own, and that's what the vaccines do for you, and that's why they're so much more effective than any medication that we can provide.
Okay, thank you.
Thank you, Jerry. John O'Connor, any follow-up questions?
Yes. With Guam tracking fairly positively so far, when might we expect to see schools opening again every day? Or is that something that the administration will decide on, or will it be dependent on the individual education institutions?
So schools are opened, and our guideline is that they can open face to face, and it really is dependent, John, on the administration of each of the schools. I know that DOE is trying to work up so that there be more days where they can do face-to-face education. But it's up to really the education department and also the various administrations in the private schools. But as far as CDC and our guideline, we have allowed opening of schools since January, I think January 28th.
To clarify that, I meant to say when are schools able to hold classes every day like they would before this whole pandemic started? But it sounds like your answer still applies to that.
Yeah, it's up to them. They can if they want to right now. There's nothing that stops them from it.
I did want to ask what you guys thought about the latest variant from France. I think reports are saying isn't detectable by standard PCR tests. So I wanted to know how you guys thought about this and how this might relate to our plans opening up Guam again.
Yeah, probably Dr. Cabrera, if he has any information about that variant.
Yeah, it's still very early to know with this particular variant overall. So they're still, they're still working on it. And this kind of goes into that question from earlier. I'm sorry, I forget who asked it, but when we do our typical testing for COVID, it's like when you hear a dog bark, like it's a dog, but you may not know what breed that dog is, and that's where the sequencing may come in through. So there may be some different ways that there may have to be some manipulation to our regular routine test to expand it. But the one in France right now, it's still very early, so I wouldn't take too much stock into what are being reported until we get more data.
Thank you very much, Doctor.
Thank you, John. Moving on, Morgan from Mariana's Business Journal. Do you have any follow-up questions?
I do have one. You mentioned a number earlier in the press conference of the amount of vaccines currently given out, and I believe that equals to about 25-ish% of the island. So if we do happen to reach that 50% marker before May 1st, are you prepared to open before that, or is May 1st kind of the date no matter what?
May 1st is the targeted date, Morgan, and the more we can vaccinate and the more that we reach beyond the 50% is even better. But we've targeted May 1st because then the travel industry will be much more better prepared to move on that date. So that's one of the reasons we've kept on that May 1st. That's less than 8 weeks from now. So.
Okay, perfect. Thank you very much, Governor.
Thank you, Morgan. Nestor Lacanto, KUAM, do you have any follow-up questions?
None for me. Thanks, Chris.
And Ethan Perez, do you have any follow-up questions?
Yes, I have one. Regarding the findings from the CDC tested samples, you mentioned that several of the positive cases and the variant, or that found the California variant, were from people who had no travel history. Is this an indicator that there could be more community spread that we aren't aware of at the moment?
Felix, you want to answer that?
So that's exactly what it means. The fact that we don't have, in particular patients didn't have a travel history, that they got it from somebody, of course, and so it is an indication of this variant. But the key part again is that has it been consequential for us? And it doesn't appear it's been consequential for us, and so that's the most reassuring part thus far.
Thank you. I have no further questions at this time.
Thank you. I would like to give the floor now to Lieutenant Governor Josh Snorio for some closing remarks.
Thank you, Crystal. I just want to ask the community to take advantage of the different options available, both for testing and vaccination. So over the last few weeks, you've been noticing that there's been community testing available. It's been up at Tizen. The governor has asked us to make sure we maintain and expand opportunities for our residents to get tested. And I think that in this situation where everything is favorable, we also want to make sure that we are very careful and remove all these vulnerabilities. And so I would just encourage people to take advantage of community testing that's available, and you can get the locations and times from our JIC reports. And then finally, of course, encourage people to get vaccinated.
And last but not least, I'd like to give the floor to Governor Leon Guerrero for her closing remarks.
Again, I think our press conference was made here so that we can be as transparent as possible to the public. But rest assured that we are also moving ahead with what our plans are. Our numbers are good. We have continued to contain the virus. We are at a 0.1 CAR score. Our hospitalization is 1 person. And so these are good things, but I don't want us, like the governor, the lieutenant governor has said, to be complacent. Be vaccinated and also get tested. And again, I cannot overemphasize the less costly mitigation efforts of wearing your mask, social distancing, washing your hands. This is why we are here today and on our way to bring back some normalcy in our island. Thank you again for your cooperation and your patience and understanding, and we will get through this together.
Thank you so much for joining us today. Please be safe.